Hello, intrepid health explorers and fans of medical innovation. Welcome back to Life of Medical. I'm your host, and tonight, we're embarking on a truly remarkable internal voyage, exploring a piece of technology that's like something out of science fiction: capsule endoscopy, often known by brand names like PillCam. Our episode is titled The Incredible Journey: A Patient's Guide to Capsule Endoscopy, PillCam, seeing your GI tract from the inside. This tiny, swallowable camera is revolutionizing how doctors examine parts of our digestive system. Let's shrink down and see how it works. What is capsule endoscopy, and how is it different from traditional endoscopy? First off, what exactly is capsule endoscopy, and how does it stand apart from what we typically think of as traditional endoscopy, like a gastroscopy or colonoscopy? Capsule endoscopy is a non-invasive diagnostic procedure that uses a tiny wireless camera housed within a vitamin pill-sized capsule to take thousands of pictures of the inside of your digestive tract. You simply swallow this camera pill, and as it travels naturally through your esophagus, stomach, and crucially, your entire small intestine, it captures images. This is fundamentally different from traditional endoscopy, where a long, flexible tube with a camera, an endoscope, is actively inserted into the body, either through the mouth or rectum, and guided by a physician. While traditional endoscopy allows for biopsies and therapeutic interventions during the procedure, capsule endoscopy is primarily a diagnostic tool, offering an unparalleled view of areas that can be difficult to reach with conventional scopes. How does the tiny camera pill work to capture images and transmit them? It's truly amazing technology, so how does this miniature camera pill actually work its magic to capture and transmit those internal images? The capsule, which is typically about the size of a large vitamin pill, contains several key components: one or two tiny cameras, a light source, usually LEDs, a battery, and a radio transmitter. Once swallowed, the capsule begins its journey, propelled by the natural muscular contractions of your digestive system, peristalsis. As it travels, the camera takes multiple pictures per second, often 2 to 6 frames. These images are wirelessly transmitted using low-power radio frequency signals to a data recorder that you wear on a belt around your waist or in a small shoulder bag. The battery life of the capsule is designed to last long enough for it to pass through the entire small intestine, typically around 8 to 12 hours. After the recording period, you return the data recorder to your doctor, and the images are downloaded to a computer for review. Where in the digestive system is capsule endoscopy most effective for diagnosis? Given its unique mode of travel, where in the vast expanse of our digestive system does capsule endoscopy prove most effective as a diagnostic tool? While the capsule captures images throughout its journey, its primary and most significant application is for examining the small intestine, also known as the small bowel. The small intestine is a very long, coiled tube, typically about 20 feet or 6 meters long, that is notoriously difficult to fully visualize with traditional upper endoscopy, which reaches the first part, the duodenum, or colonoscopy, which reaches the very end, the terminal ileum. Capsule endoscopy provides a non-invasive way to get a detailed look at the entire length of the small intestinal mucosa, making it invaluable for finding problems in this hard-to-reach area. While there are versions designed for the esophagus and colon, small bowel capsule endoscopy remains its most common and impactful use. When is capsule endoscopy typically recommended by doctors? So, when would your doctor typically recommend a capsule endoscopy procedure? The most common reason is to investigate obscure gastrointestinal bleeding, meaning bleeding where the source hasn't been found by upper endoscopy or colonoscopy. If a patient has unexplained iron deficiency anemia or visible signs of bleeding, and other tests are negative, capsule endoscopy can often locate a bleeding site within the small intestine. It's also a key tool for diagnosing and monitoring Crohn's disease of the small intestine, as it can detect inflammation, ulcers, and strictures. Doctors may use it to look for small bowel tumors or polyps, although these are less common. It can also be helpful in evaluating suspected celiac disease by visualizing the characteristic changes in the small intestinal lining. especially if biopsies from traditional endoscopy are inconclusive or if the patient cannot undergo an invasive procedure. It's generally considered after other initial investigations have not yielded a definitive diagnosis for small bowel conditions. Why would a doctor choose capsule endoscopy over other diagnostic methods for certain conditions? This leads to the question of why a doctor might opt for capsule endoscopy over other diagnostic methods, like a traditional small bowel enteroscopy or imaging studies like CT or MRI enterography. The primary advantage of capsule endoscopy for small bowel evaluation is that it is non-invasive and patient-friendly. There's no need for sedation or an invasive intubation procedure. Patients can generally go about their normal day, with some restrictions, while the capsule does its work. It provides direct visualization of the entire small bowel mucosa, which can offer more detailed information about superficial lesions than some radiological imaging. While small bowel enteroscopy, where a longer endoscope is used, allows for biopsies and treatment, it is a more complex and invasive procedure, often requiring deep sedation or general anesthesia and carrying more risks. Capsule endoscopy often serves as an excellent initial diagnostic tool for the small bowel, helping to guide decisions about whether more invasive procedures are necessary. Who is a good candidate for capsule endoscopy and who might not be? It's important to consider who is a good candidate for undergoing capsule endoscopy and, conversely, who might not be suitable for this procedure. Good candidates are typically individuals who need a detailed examination of their small intestine, especially for the reasons mentioned earlier like obscure GI bleeding or suspected Crohn's disease, and who have no known obstructions in their digestive tract. Patients who can swallow the capsule and are able to follow the preparation instructions are generally suitable. However, capsule endoscopy is not for everyone. Individuals with known or suspected intestinal strictures, narrowings, or blockages may not be good candidates, as the capsule could get stuck, potentially requiring surgical removal. Patients with swallowing disorders might have difficulty ingesting the capsule. Those with implanted electromedical devices like pacemakers or defibrillators need to discuss potential interference with their cardiologist, though modern capsules are generally considered safe. Pregnant women are also usually advised against it due to the unknown effects of the radiofrequency signals on the fetus. A thorough medical history review by the doctor is essential. Preparing for your capsule endoscopy journey. If you're scheduled for this procedure, knowing about preparing for your capsule endoscopy journey is key. Preparation is crucial for ensuring the camera gets clear images. Your doctor will provide specific instructions, but typically, this involves a period of fasting. You'll likely be asked to have only clear liquids for a certain period, often the afternoon before, and then to fast completely, no food or drink, for about 10 to 12 hours before swallowing the capsule. You may also be prescribed a bowel preparation solution to drink, similar to that used for a colonoscopy, to help cleanse the small intestine of residue and ensure the camera has an unobstructed view. It's also important to inform your doctor about all medications and supplements you take, as some may need to be adjusted or temporarily stopped. Good preparation significantly improves the diagnostic quality of the study. The capsule endoscopy procedure, swallowing the camera. Let's walk through the capsule endoscopy procedure, swallowing the camera. On the day of your procedure, you'll go to the clinic or hospital. The staff will first attach a sensor array, adhesive antenna pads, to your abdomen or provide you with a sensor belt. These sensors help detect the signals from the capsule. This array is connected by wires to the data recorder, which you'll wear on a belt or in a pouch. Once everything is set up, you'll be given the capsule, the PillCam, and a glass of water to help you swallow it. It's about the size of a large vitamin pill and is designed to be easy to swallow for most people. After successfully swallowing the capsule, the recording begins. The staff will check that the system is working correctly, and then you're usually free to leave and go about most of your normal daily activities, with some instructions about eating, drinking, and physical activity. What happens after swallowing the PillCam? Data recorder, daily activities. So, what happens after swallowing the PillCam? You'll wear the data recorder for approximately 8 to 12 hours as the capsule makes its journey. During this time, a light on the recorder will usually blink to indicate it's receiving data. You'll be given instructions about when you can start drinking clear liquids, usually a couple of hours after swallowing the capsule, and when you can have a light meal, typically about 4 hours after. It's important to avoid strenuous physical activity, bending or stooping, as this could interfere with the recording. You should also try to avoid strong electromagnetic fields, like those from MRI machines or ham radio equipment. You'll need to periodically check the recorder's blinking light to ensure it's still working. At the end of the recording period, you'll return the data recorder and sensor array to your doctor's office as instructed. The capsule itself is disposable and will eventually pass naturally out of your body with a bowel movement. Usually within a day or two, you don't need to retrieve it. Reviewing the voyage, how doctors analyze the images. Once you've returned the data recorder, the next step is reviewing the voyage, how doctors analyze the images. The thousands of images, sometimes 50,000 or more, captured by the capsule are downloaded from the data recorder onto a specialized computer workstation. Your gastroenterologist, who is trained in interpreting these studies, will then meticulously review this video footage. They'll look for any abnormalities in the lining of your small intestine, such as sources of bleeding, like ulcers or angiodysplasias, which are tiny abnormal blood vessels, areas of inflammation suggestive of Crohn's disease, polyps, tumors, or signs of celiac disease. The software allows them to speed up, slow down, pause, and magnify the images. This detailed review can take a significant amount of time. After analyzing all the images, the doctor will compile a report of their findings, which will then be discussed with you at a follow-up appointment to determine the next steps in your care. Potential risks and limitations of capsule endoscopy. While generally very safe and non-invasive, it's important to be aware of the potential risks and limitations of capsule endoscopy. The main risk, though uncommon, occurring in about 1 to 2% of cases, is capsule retention, where the capsule gets stuck in a narrowed segment of the intestine, a stricture, due to underlying disease like Crohn's, a tumor, or adhesions from previous surgery. If this happens, the capsule might need to be removed endoscopically or, rarely, surgically. To minimize this risk, your doctor might order a patent capsule test beforehand if there's a concern about a stricture. This is a dissolvable dummy capsule that, if it passes through, indicates it's likely safe for the actual camera capsule. Other limitations include the inability to take biopsies or perform any therapeutic interventions during the procedure. Occasionally, the images might be unclear due to poor bowel preparation or rapid transit. Also, the capsule's movement is passive, so it can sometimes miss lesions if it moves past them too quickly or if they are hidden behind folds. And that's our fascinating look into the world of capsule endoscopy. A tiny pill undertaking an incredible journey to give doctors an invaluable view inside our small intestine. It truly highlights how far medical technology has come. I hope this has illuminated the PillCam procedure for you. If you found this information helpful, please give this video a big thumbs up, subscribe to Life of Medical for more explorations of medical marvels, and hit that notification bell. Stay curious, stay healthy, and we'll see you in the next video.